The purpose of this video is to describe current state challenges present in large, complex organizations using state Medicaid environments as the example. This content builds upon the challenges we identified that are commonly present in the IT delivery model. This video is part 2 in a series of videos to explore the challenges involved in large-scale system transformation work. To recap the prior video, we've defined a few key terms that are important for setting the context, as well as the most critical IT delivery challenges to consider. We laid out the following key concepts and terms to define this model. First, there's the current state, the existing structure, processes, and technology architecture supporting the organization's ability to fulfill its mission. There's the future state, a planned revision to the current state, hopefully capable of fulfilling the organization's mission more effectively, once improved by an IT delivery initiative. There's the scope, a solution idea proposed to change the current state to a different future state with an expectation of improvement, activities, work performed to deliver the scope, outputs, tangible deliverables resulting from the activities, mandatory compliance items, requirements established for the purpose of limiting risk and avoiding major incidents. Note, we consider the compliance requirements to apply to the current state, improvement activities in progress, and the future state environment. Outcomes, near-term results experienced through activities and output delivery, ideally measurable with leading indicators and ideally traceable to a scoped initiative. Impact, the organizational impact experienced once improved by an initiative, which is often challenging to associate with near-term activities, but still important to measure. For clarity purposes, perhaps we should refer to the desired outcomes and impacts as desired future outcomes and future impacts to differentiate this from the current outcomes and current impact being experienced today in the existing environment. We highlighted 3 summary-level issues that manifest from typical IT delivery models. A main source of many problems is with the scope, that it's hard to predict which ideas will lead to improved outcomes. We then have the issue that a lack of focus, understanding, and accountability for outcomes often drives a focus on activities and outputs, preventing organizations from understanding which scope ideas drive positive results. And we have the issue that lead times are often much too long, preventing organizations from knowing if the scope improves outcomes until it is too late to change course. With this background, let's dig in further on the Medicaid current state environment and identify unique challenges we see in this environment. As mentioned in the prior video, we find most scope ideas originate from people in the current state environment who observe poor outcomes or critical business operations issues and want to improve things. For Medicaid, this includes but is not limited to the recipients of state services, providers of services, staff supporting providers and recipients, policy experts, contract managers, people managers, and leaders. At the executive level, these ideas are commonly communicated through a strategic vision or strategic plan, which often includes input and insight from strategic advisory vendors in the industry who can suggest newer solution ideas they have seen working in other organizational contexts. In some cases, decisions have been made to outsource much of the operational work, ranging from small vendors performing individual business functions to large managed care organizations comprehensively administering the state health plan. Modularity rules have resulted in an expansion of the number of vendors required to implement and manage state IT solutions. When heavily relying on vendors, a much higher focus is placed on oversight, with data analysts and contract managers becoming critical end users of the vendor and agency data from the agency perspective. Not only do all the folks we've just mentioned have ideas, but also external regulators, legislators, and the federal partners who provide funding. Once in a while, new ideas will be handed down in the form of laws, policies, or program mandates, which may conflict with the agency's stated strategic vision. To handle smaller ideas that can be implemented in the current state environments, states often have an internal PMO or project management office, potentially multiple PMOs, including vendor PMOs, depending on how the organization is structured. These management entities oversee implementation projects that take ideas through this idea-to-outcome improvement lifecycle. As covered in the prior video, our inability to be sure about which solution ideas will achieve our desired outcomes affects all organizations, but we find state environments tend to amplify this issue. Industry-leading practices indicate that the best ideas originate from a continuous discovery process in which skilled practitioners observe and interview the people closest to the solution space, especially when guided by a clear outcome-based vision and in collaboration with policy experts aligned to that vision. However, in government environments, organizational siloing is common, creating communication barriers between key groups that should be collaborating fluidly. There is typically low trust between groups, and the responsibility for idea generation often resides with individuals several layers removed from the point of member interaction. Medicaid business environments are highly complex and subject to many complicated laws and policies that must accommodate a huge range of conditions from remote rural to dense urban population centers, and from common preventative services to acute care only possible through government-provided services. We find that there are often many competing interests from several different state and federal agencies and departments, lacking goal alignment and commonly following different processes and procedures. Navigating the defined requirements for all entities at one time can be extremely difficult. Medicaid agencies often don't have approval for sufficient staffing capacity, and the devoted individuals who are left to manage this environment are typically swamped, with little time to devote to work beyond urgent emergencies. Minimal capacity is available to actively manage vendor performance in alignment with changing outcomes, leaving vendors self-monitoring performance based on outdated contractual terms. Even if capacity were available, states often feel unable to effectively performance manage vendors due to procurement and contract laws and regulations. Priorities are also highly subject to political forces that may reverse direction entirely as new legislators and governors are elected or appoint new leaders. Decision-making in this structure can be challenging, often resulting in communication delays while ideas make their way from the decision-makers to the doers, further lengthening lead times and creating backlogs of overlapping and conflicting ideas to be implemented with little clarity on priority or value. Backlogs that can quickly overwhelm state IT delivery mechanisms, resulting in only the most urgent issues receiving attention. Another factor contributing to long lead times in these environments is the state of existing systems and architecture. The technology has often been developed over time hastily in response to legislative mandates or leadership priorities without considering previous solutions. This has led to highly coupled systems, often resembling an archaeological dig site with layers upon layers of outdated systems and processes still being used to minimally support business operations. In cases in which newer technology has been implemented, it is often throttled back to the lowest effectiveness level of the policies and procedures surrounding it, as well as constrained by the older layers of technology still in play. Commonly, the individuals who designed and built prior solutions have retired or left without sufficient transition, and system documentation is unavailable or incomprehensible. Rarely is time allocated to maintaining the source of truth for critical system information once it's created. Making changes in these environments can be risky and quite time-consuming, resulting in lead times measured in months or even years. Many states are struggling to maintain these environments on the verge of critical failure due to decades of accrued technical debt. As bad as these environments often are, we find they are typically a symptom of deeper institutional issues. The environment surrounding the technology is poorly designed for the digital age. We see our dedicated public servants caught in an accountability trap, in which accountability for outcomes is retained at the highest level of the organization and accountability for following direction is pushed downward. This is a systemic issue, not at all the fault of the amazing individuals in these roles doing the best that they can, but who are evaluated on how well they follow the process rather than whether their actions improve outcomes for the organization. The end result is a self-perpetuating cycle. The impact achieved by the current environment is often so poor that there is intense pressure from legislators and other stakeholders to implement solution ideas faster, mostly generating more activity and outputs, but rarely improving outcomes or impacts. The poor impacts are very public, and government leaders are under pressure to deliver quick fixes, often resulting in requests to modernize this aging technology. Given the limited in-house capacity, the only option often available is to outsource this work to large technology vendors, with little to no understanding of the current environment. Rarely are the environmental issues addressed or even acknowledged. Let's stop here and recap our summary challenges list so far. Based on this analysis, we've added 2 summary issues to our list. In addition to the scope, outcomes, and lead time issues identified, it seems the current state technology and environment conditions surrounding Medicaid enterprises are also key contributors to overall outcome struggles. This brings us to the challenges facing our modernization initiatives and where our governance structures play a part in these challenges, which we'll cover in the next videos. I hope this overview reflects your experience and helps to provide a concise summary of the factors you feel prevent you from achieving better results. See you in the next video.
Thanks for watching. In the YouTube notes, you'll find links to the next videos and ways to engage in the conversation. Look forward to hearing from you.